Hi, I'm Garvin. Welcome to our telehealth video series. In this video, I will give a brief overview of what you need to know about strokes. In particular, I'll cover what is a stroke, how do you treat a stroke, and how you can live more successfully following a stroke. So we start with, what is it? A stroke occurs when the blood supply to part of your brain is interrupted or severely reduced, depriving brain tissue of oxygen and food. Within minutes, brain cells begin to die. A stroke is a medical emergency. Prompt treatment is crucial. Early action can minimize brain damage and potential complications. The good news is that strokes can be treated and prevented, and fewer Irish people now die of stroke than was the case even 15 years ago. So the symptoms of a stroke are, so watch for these signs and symptoms if you think you or someone else may be having a stroke. Note when signs and symptoms begin, because the length of time they have been present may guide treatment decisions. So trouble with walking. You may stumble or experience sudden dizziness, loss of balance or loss of coordination. Trouble with speaking and understanding. You may experience confusion, and you may slur your words or be unable to find the right words to explain what is happening to you. Try to repeat a sample sentence. If you can't, then you may be having a stroke. Paralysis or numbness on one side of your body or face. You may develop sudden numbness, weakness or paralysis on one side of your body. Try to raise both of your arms over your head at the same time. If one arm begins to fall, you may be having a stroke. Trouble with seeing in one or both eyes. You may suddenly have blurred or blackened vision, or you may see double. And a headache. A sudden severe bolt out of the blue headache, which may be accompanied by vomiting, dizziness or altered consciousness, may indicate you're having a stroke. A stroke disrupts the flow of blood through your brain and damages brain tissue. There are two chief types of stroke. The most common type, ischemic stroke, results from a blockage in an artery. The other type, hemorrhagic stroke, occurs when a blood vessel leaks or bursts. A transient ischemic attack, sometimes called a mini-stroke, temporarily disrupts blood flow through your brain. Ischemic stroke, so almost 90% of strokes are ischemic strokes. They occur when the arteries to your brain are narrowed or blocked, causing severely reduced blood flow, ischemia. Lack of blood flow deprives your brain cells of oxygen and nutrients, and cells may begin to die within minutes. The most common ischemic strokes are thrombotic stroke, embolic stroke and hemorrhagic stroke. So a hemorrhagic stroke occurs when a blood vessel in your brain leaks or ruptures. Brain hemorrhages can result from a number of conditions that affect your blood vessels, including uncontrolled high blood pressure or hypertension and weak spots in your blood vessel walls, aneurysms. There are two types of hemorrhagic stroke: intracerebral hemorrhage and subarachnoid hemorrhage. So now, what is a transient ischemic attack? So a transient ischemic attack, or sometimes called a mini-stroke, is a brief episode of symptoms similar to those you'd have in a stroke. The cause of a transient ischemic attack is a temporary decrease in blood supply to part of your brain. So many TIAs are less than 5 minutes. So next is, how do you treat a stroke? Emergency treatment for stroke depends on whether you're having an ischemic stroke, blocking an artery, and the most common kind, or a hemorrhagic stroke involving bleeding in the brain. So an ischemic stroke. To treat an ischemic stroke, doctors must quickly restore blood flow to your brain. Emergency treatment with medications, therapy with clot-busting drugs must start within 4 to 5 hours, and the sooner the better. You may be given aspirin. So intravenous injection of tissue plasma activator. And emergency procedures. Doctors sometimes treat ischemic strokes with procedures that must be performed as soon as possible. And hemorrhagic stroke, emergency treatment of hemorrhagic stroke focuses on controlling bleeding and reducing pressure in the brain. Surgery may also be used to help control future risk. And emergency measures, if you take warfarin or antiplatelet drugs such as Plavix to prevent blood clots, you may be given drugs or transfusions of blood products to counteract their effects. Surgical blood vessel repair. Surgery may be used to repair certain blood vessel abnormalities associated with hemorrhagic strokes. Aneurysm clipping is a tiny clamp is placed at the base of the aneurysm, isolating it from circulation of the artery to which it's attached. So coiling or aneurysm embolism and surgical AVM removal. And finally, how do you improve your quality of life following on from a stroke? So if you've had a stroke or a TIA, these measures may also help you avoid having another one. So many stroke prevention strategies are the same as preventing heart disease. So stop smoking. Smoking is a major risk factor for heart disease. Control your blood pressure. Optimal blood pressure is below 120/80. Check your cholesterol. Ask your doctor for a baseline cholesterol test when you're in your 20s, and then at least every 5 years. Keep diabetes under control. If you have diabetes, tight blood sugar control can help reduce the risk of heart disease. And get moving. If you have heart disease, exercise helps you maintain a healthy weight. And eat healthy foods. A heart-healthy diet based on fruit, veg, and whole grains, and low in saturated fat, cholesterol, and sodium. And maintain a healthy weight. Being overweight increases your risk of heart disease. And manage stress. So reduce stress as much as possible. Finally, there are numerous products available at Lynch's Pharmacy in Douglas to assist you in managing a stroke going forward more effectively on a day-to-day basis. To start with, we have numerous products to get you started on a gentle exercise program, such as exercise balls, floor mats, weights, and various other items to get you up and running on a program we create and is tailored specifically to you. We also have various supplements and products which you can purchase from us without a prescription, such as flaxseed, omega-3 fish oils, cod liver oil, omacar, psyllium husk, the CoQ enzyme 10, vitamin B and vitamin D, magnesium. Plus we stock light boxes to promote relaxation, and blood pressure monitors, blood sugar monitors, and body fat monitors, and assisted living devices. So that brings this video to an end. Customers of Lynch's Pharmacy can avail of a brand new offering, a telehealth clinic. You can book a 30 minutes clinic with us, and we help to increase your understanding of your illness. During a telehealth clinic, together we create a cohesive management plan which enables you to take a more active role in managing a stroke going forward with confidence. We provide you with the tools you need to live a healthy life. Call into us at Lynch's Pharmacy in Douglas, in Cork, or call 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.